it's like a cost of living adjustment. And it really is long overdue, as we know how food prices have escalated in just the past few months, let alone the last 15 years since these were adjusted. So it really is a cost of living adjustment to make sure that the allowance that is provided for families who really need this added income for food have enough to make healthy choices.
According to a USDA study published earlier this summer, nearly 9 out of 10 participants in the Supplemental Nutrition Assistance Program, or SNAP, reported facing barriers to achieving a healthy diet, with the most common barrier being the cost of healthy foods. As part of a reevaluation of the 2021 Thrifty Food Plan, which puts healthy food in reach for SNAP families, the USDA determined that benefit levels are too low to provide for a realistic healthy diet, even with households contributing their own funds toward groceries. As a result, for fiscal year 2022, beginning October 1st, the average SNAP benefit, excluding funds provided as part of pandemic relief, will increase by just over $36 per person per month. On today's Sound Living, affording healthy food. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Agriculture Secretary Tom Vilsack says that a modernized Thrifty Food Plan is more than a commitment to good nutrition. It's an investment in our nation's health, economy, and security. He also says ensuring low-income families have access to a healthy diet helps prevent disease, supports children in the classroom, and reduces health care costs. SNAP helps to feed more than 42 million Americans, or 1 in 8, each month, and increases food security for low-income families. In its reevaluation, K-State Research and Extension Nutrition Specialist Sandy Procter says USDA was driven by the latest available data on 4 key factors identified in the 2018 Farm Bill: current food prices, what Americans typically eat, dietary guidance, and the nutrients in food items. Sandy, a chance to talk about an update to a program that's been around for a long time. It's the Thrifty Food Plan and SNAP benefits. And as part of this, they have finally decided to really investigate how prices stack up today as compared to several years ago. And what they're finding is that there really needs to be an increase in the benefits.
Yeah, Jeff, this is really interesting. We have heard off and on almost every year talk about need for more money for SNAP programs. But what this really does is look at the other side of it and say, we are looking at the costs, the actual costs of what it takes to feed your family healthfully. The USDA, for many years, since the 70s, has had their different food plans. Economists look at what it costs to make different levels of meals that are healthy enough to fit the dietary guidelines, but at different economic levels. And what this work did was, and it was driven by the last Farm Bill that said, we need to look at that, sort of that framework that assumes that this is how much it costs to feed your family healthily. And the question that Congress and the Farm Bill asks is, take a look at it, be sure that what we're assuming can be done with the amount of money that has been allowed by law to come through for SNAP is actually possible. And what they found out was, since this was the first adjustment to the amount of money since 2006, you and I could pretty well guess that there was going to be a gap between what was being requested of people on this food plan and what was actually possible.
And they found that to be about $36 per person a month.
That's the gap that they're going to fill with this change come October 1st. And so $36 per month, or just really about $1.19 a day per person.
This is a USDA program, and you mentioned that they've been looking at current food prices. That was one of their 4 key factors that they investigated. Another one was what Americans typically eat, so that would then be falling within the dietary guidelines?
Well, that's a gap, and you know that that's an issue. But they needed to see just how far that assumption of a healthy food plan was from what was actually happening and what was actually available or accessible because of the amount of money to people on the lowest level. There are 4 different levels of this eating plan that have been developed through the years. This Thrifty Food Plan is really quite low But then there is also the low cost, the moderate cost, and the liberal food plans. And those look at the same guidance, but they allow more money to meet those dietary goals. And some of us would fall in that. But for that very low cost level, it's very difficult to make the healthy choices that we recommend through the dietary guidelines.
The dietary guidance was another key factor that they looked at, and also nutrients. So we're looking at really nutrient-dense type foods?
Right. As we've talked about on this program before, when your budget is tight, you really don't have a lot of wiggle room, just like we don't have calorie wiggle room to eat a lot of other foods. We don't have a lot of money to buy other things. But we also know that nutrient-dense foods oftentimes are more costly than low-cost, less healthful foods. And that's where the situation really comes to a head. If low-income people are not able to afford healthier foods, we're building the problem in instead of helping erase it.
Let me put you on the spot here. Throw out a couple of nutrient-dense foods that might spur us to think, oh, okay, that's what that is.
Here's a good example. We know that plant-based foods like beans and lentils and peas and dried beans, those are very healthy foods. And they're very inexpensive when you buy a pound bag of beans. But you also know that if you have a job or maybe two jobs, a number of kids, lots of comings and goings, your schedule's tight, that maybe that pound of beans isn't the most usable or even practical solution to hunger. Sure, it's there, and yes, you can make it work. But if I can afford a few more cents and buy canned beans, I can still have those same nutrients and have the ability to get that meal, that healthy meal on the table much faster.
They held some listening sessions with people who were on the Thrifty Food Plan. We don't exactly know what was said or what they came up with, but we can only assume that that was probably something that came up is, I need something that allows me to make meals quicker with less energy and less time.
And the most common barrier that they reported was not even about time or the unrealistic ingredients that might be available at that lower price level, but it's the cost of healthy foods. If I want to go into a store and buy fresh fruits and vegetables, that probably is going to be more expensive. For some things, there may be seasonal products that are really cost-effective, but for some things, it's going to maybe cost more than a less healthy version or a product that may have some fruits and vegetables, but maybe packed in syrup or something like that. So the people who reported on these listening groups were saying that they simply couldn't afford healthy foods.
In terms of the child aspect, when we're trying to feed children, we know all of the benefits of that, trying to prevent chronic disease and making sure that they're ready to go to school and learn and things like that. They're getting the nutrition they need to thrive. This is a program that actually meets those needs, or at least tries to meet those needs.
Well, think about it. It's kind of hand in glove, and then glove meeting glove and holding hands. It fits with those other USDA programs like the school nutrition programs. But, school, although they are making great strides, they certainly aren't providing every meal for kids. And families need to be able to have enough money to feed their own kids at those times when school meals aren't available. And so this is going to help build that foundation. So it's like a cost of living adjustment. And it really is long overdue, as we know how food prices have escalated in just the past few months, let alone the last 15 years since these were adjusted. So it really is a cost of living adjustment to make sure that the allowance that is provided for families who really need this added income for food have enough to make healthy choices.
Well, and really even just for anyone's health, we know how much health costs are and how many problems really stem from poor nutrition.
And they certainly aren't stopping with this Thrifty Food Plan. They're going to look at all 4 levels of these food plans and make sure that the costs reflect what it costs all of us to make those healthy choices, because it is expensive. And especially in states that charge, food tax, it is an expensive undertaking to make those healthy meals and to keep our families healthy through the food that we choose and that we prepare.
Education is also part of this, and Extension plays a role in SNAP education. We like to call it SNAP Ed because we shorten everything. Tell me just a little bit about how that program works.
Well, in Kansas, K-State Research and Extension is the only agency that delivers SNAP education. So it's funded through the SNAP program, and it really is the education arm. We can't just expect people to receive money for food and then not support that with education on how to use those limited food dollars and make healthy choices. They provide recipes that use healthful ingredients, but they're cost-effective. Actually, they provide recipes that other programs, like some of the other government programs that provide foods or commodities to people, they build on those lists that come out and actually provide recipes of the foods that month that make it so when I receive this food package, I know what to do with those ingredients. And they work with individuals to better feed young children, how to make sure that seniors have a healthy, active lifestyle and continue to make those healthy food choices into their later years. And it's just a program that really is adaptable. It fits with the needs of the community all across the state.
That's a good point, because we often think of SNAP benefits as being for families or younger families, but SNAP benefits apply across the spectrum, right?
Absolutely. We know that some, not all, college students are able to access SNAP benefits, and many of them certainly are eligible for those benefits. And we know that hunger and food access are real issues for those young adults. But we also know there are many, many individuals and families. Multiple jobs may not pay a lot of salary or wages, but they also from that need to think about rent and transportation and childcare. And when you figure all those in, sometimes it is nutrition that takes a back seat.
For a family of 5, this would be about $180 or so more per month. Tell me the difference that could make.
Well, just think about it. If you're in the grocery store and you're buying several sackfuls of groceries, $180 is going to be quite a lot of purchases, depending on what you're buying and how you plan those meals and what is available in the store that you're able to get to and all those things. But if you have some of those tools, and we hope and know that our SNAP families, many of them take part in some of the programs that help educate and make those choices. Many people, if they just had more money, are ready, willing, and able to make those choices. And so think if you're really working with your food budget, $180 to help stretch your food budget is really going to make a huge difference across the month, especially if you're used to making meals and making do with that much less.
I think what I'm hearing you saying is they probably already know how they would spend that extra money if it ever came in, and starting in October, some of that will be coming in.
We heard firsthand just how that worked. Some of the surveys that were done with participants that received the child stimulation checks that just went out, and there were interviews that were done with families and parents, and the recipients' number one response was, it will allow me to better feed my family. So the checks that came in to support child care and children in the family, the first response was, that will go to help better feed my family. So there are gaps there. There are issues, and families are looking for ways to better feed their families. And this increase in the Thrifty Food Plan will certainly help.
As we mentioned, education a big part of this, and if someone would like to learn more about the SNAP Ed program, they can just contact their extension office?
Yes, SNAP Ed is available across the state in different areas and counties, and so talking to their extension office about that program is a good place to start, as is a lot of information about eating more healthfully and accessing recipes or how to stretch your food budget. All of those same topics can be covered with information from your local extension office.
That's K-State Research and Extension Nutrition Specialist Sandy Procter. To learn more about the Supplemental Nutrition Assistance Program, or SNAP, visit fns.usda.gov/SNAP. For information on the health and nutrition programs offered by Extension, contact your county or district extension office or visit ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.